To answer this question, I used a study titled Immunization Safety Review, Multiple Immunizations and Immunization Dysfunction. This study compiled data from a number of different tests around the world to determine the effects of different vaccines on the rates of infectious disease, hospitalizations, allergies, and bacterial infections. One of these trials was performed in Germany and examined the risk of morbidity due to infectious disease in 662 infants who were randomly appointed to receive their first vaccines for diphtheria, pertussis, whooping cough, HIV, and polio at different times after birth.
The scientists asked mothers to keep a daily journal and record any coughing, rhinitis, restlessness, vomiting, rash, pain, poor food or fluid intake, fever, or respiratory issues.
The results of the study showed that unvaccinated children were hospitalized at a rate 4 times higher than those who were vaccinated.
In order to answer this question, I used a number of studies done in the late 90s and early 2000s that were designed to determine if there's a causal relationship between a number of vaccines and type 1 diabetes mellitus, an autoimmune disorder. The first 2 studies were uncontrolled observational studies. In Finland in 1999, scientists observed diabetes rates in children before and after the introduction of the MMR vaccine to the vaccination schedule.
Because there was no recorded increase in the amount of diabetes cases, it has been concluded that there is no causal relationship between the MMR vaccine and diabetes mellitus.
The next study I used was performed in New Zealand and was very similar, except children were already regularly vaccinated for MMR, DTP, and OPV, and the hepatitis vaccine was being added to the regimen.
After the introduction of the hepatitis vaccine, diabetes rates were recorded to be rising from an incidence of about 11.2 per 100,000 to 18.2 per 100,000.
The next 4 studies I cited were performed across America, Europe, Finland, and Sweden. Each of these studies were case-controlled and followed children with and without diabetes, recording their immunization records and other personal information to help classify the data correctly. Not one of these studies found a correlation between type 1 diabetes and any vaccinations or lack thereof. One study, performed in Sweden, mainly talked to parents and inquired as to why they were hesitant to get their children the MMR vaccine. The majority of parents said that they had done research online and felt that their healthcare provider had not discussed the vaccine with them at enough length for them to be comfortable giving it to their child. An article written by the NIH suggested similar reasoning, saying that parents had so much access to false information that it was easy for them to get overwhelmed. Overall, the largest concern was the safety of vaccines like MMR and HPV. In 1998, a study was done by British scientist Andrew Wakefield that seemed to show that the MMR vaccine caused autism. Many parents latched onto this idea, and it was one of the driving factors behind the early anti-vaccine movement. What many people seem all too willing to ignore are the details. This study only focused on 12 patients, and later review showed that most of the results were falsified. The doctor that ran the study lost his medical license, and there are now dozens of papers proving that his work is inaccurate, but the damage has already been done. The MMR vaccine is most commonly fought against because of its supposed connection to autism and lack of parent education on the vaccine. Scientists make vaccines with the intention of helping people, and when people start to question the vaccine's validity, scientists always want to make sure that their discoveries are saving lives. Any questions and theories are tested, like you saw with the studies on morbidity and type 1 diabetes, to ensure that if they carry any weight, the problem can be resolved, and if not, any fears can be relieved.